Eyewitness News is your vaccine authority, and we are still getting so many of your questions about all the vaccines. And joining us live this afternoon is another expert, Dr. Ulysses Wu, infectious disease specialist with Hartford HealthCare. Dr. Wu, thank you very much for joining us today.
Happy to be here. Thank you for having me.
Well, let me ask you first up, because as I said, we're getting so many of these questions, and a lot of them involve birth control. So this one came in. Someone said, does being on birth control pills have anything to do with blood clotting concerns associated with the vaccine?
It likely doesn't have anything to do with it. So being on birth control pills itself does slightly raise the risk and increase the risk of possibly developing blood clots by itself. We know that the vaccine itself, the J&J vaccine in particular, not necessarily the mRNA vaccines from Moderna and Pfizer, that there is this syndrome that we call that where there's blood clotting with low platelets or thrombocytopenia as well. But we also know that if you get COVID, you're at very high risk for getting blood clots as well, much higher than the vaccine itself. And so everything's relative, including smoking, including long car rides and airplane trips and everything. So everything has a risk in itself. I
would imagine, though, you are encouraging people to get the vaccine still, correct?
1 billion%, absolutely. Because we have to remember that there was a time period in the winter we were losing the equivalent of a 9/11 every single day from this virus alone. And so the devastating consequences of possibly dying from this virus, if not having, even if you do live, you can still have long-term sequelae associated with the virus, absolutely should be getting the vaccine.
Okay, now here's another question for you this afternoon. If you had COVID and had monoclonal antibody treatment, is it necessary to get the COVID shot?
That's a great question. It is absolutely necessary to get the COVID shot for sure. However, there's a small caveat for that. We do ask that you wait 90 days from your last monoclonal antibody dose, I will say, or the last time you received the medication, because it could interfere with the immune response of the vaccine itself.
Can I ask you lastly, Doctor, are you comfortable right now with the changes with the CDC and mask wearing and all that, what they're talking about?
So I am comfortable with it, actually, but we still need to exercise caution. So before this happened, we were saying that our biggest issues or our biggest things that we had to do was, number one, we had to wear masks. Number two, social distancing. Number three, we had to do hand hygiene. Number four was vaccines. And when we did number four, very early on in the beginning, we seemed to forget numbers 1, 2, and 3. But now that more and more people are getting vaccinated, what is great about this is that as we are getting some sort of immunity, it makes the possibilities of wearing masks in certain situations. I'm not saying all situations, but if you're outdoors, if you're with other vaccinated people, if you're indoors with other vaccinated people, probably not as important. And the reason the CDC is doing it now is because they looked at all the signs. And the CDC is very slow when it comes to this. So they moved very slow with this, and that is good, because they wanted to make sure that they made the right decision. Yeah, so I do agree with it.
Better safe than sorry, I guess you would say, right?
Absolutely.
All right, Dr. Ulysses Wu, thank you so much for joining us this afternoon from Hartford HealthCare. Always good to see you. We appreciate your time.
Thank you for having me again.